Hi there, I'm Brittany Golden and I am a functional medicine nutritionist with Nuvi Nutrition, a Forum Health partner. And I'm here to talk to you today about PMS. It is Women's Health Month with Forum Health. And so we're delivering some topics specifically regarding women's health issues as they are so prevalent and just different ways of dealing with them in a functional medicine light. So today's topic, like I said, is PMS and the common symptoms associated with that and kind of how we deal with bringing those into balance. So common symptoms of this would be things like headaches, dizziness, irritability, breast tenderness, bloating, nausea. Some women actually have vomiting spells, food cravings or aversions, weight gain, irritability, depression, anxiety, fatigue, cramps. It's endless. There's so many different things. The severity of the symptoms along with the length of the period varies due to numerous factors for each woman, and this is kind of due to genetics, diet, activity level, their age, the hormone levels, which we wouldn't know without doing proper testing, what their environment is like, what their stress levels are like, just to name a few things that could cause an imbalance here. Many things can help alleviate these symptoms naturally, and what works for one doesn't always work for everybody, but some things that we can try I'm going to go over today. So the thing is with functional medicine, we want to get to the bottom of why these things are happening in the first place. So the cause for PMS is simply this: your hormones become unbalanced because your estrogen levels and progesterone levels decrease either relatively or absolutely. So there's different varying degrees of this, like I said, wouldn't know without lab testing, but there are things you can do to promote proper balance, coming into check. So a couple things that would be, basically 5 simple steps to eliminating PMS. Number 1 is to clean up your diet. So this means stop eating the refined flour, the sugar, the processed foods. Cut out caffeine or at least significantly decrease it. Eliminate alcohol. Balance your blood sugar by eating good proteins, breakfast, lunch, and dinner, basically. It's going to keep you nice and full. Eat evenly throughout the day. Don't skip meals. That's huge for balancing your blood sugar. Try not to avoid eating 3 hours before bedtime. Cutting out dairy and considering other common allergens like gluten, soy, sometimes corn, a lot of inflammatory foods in the American diet. Increasing fiber can be helpful. This helps to correct constipation issues, which then can balance hormones appropriately as well. Increasing your omega-3s like salmon and flax and nuts and seeds. Eating organic, especially when it comes to animal products, so that you're avoiding all of the estrogens and the hormones that are added in. Supplements that can be helpful. Things like taking, like I said, with the diet, omega-3s, taking a good quality omega-3 fish oil. Taurine can help with liver detoxification. Taking a good multivitamin, which helps all your nutrients sort of work together. Taking magnesium can be helpful also. It's very calming, but really, really responsible for a lot of different jobs in the body, and hormone balance can be one of those things. Flax, like I had mentioned with the diet, taking, kind of intentionally taking flax, adding it to your oatmeal or smoothies. Balancing your gut flora is another step, kind of step 3 for really helping to balance your hormones, because your gut is where normal, healthy estrogen metabolism takes place. And if your gut is not in a good spot, doing its job, it's not going to do that detoxification. When it comes to any supplements, I do want to make sure I add in, you want to be working with a practitioner, a knowledgeable person that's going to be, making these recommendations, possibly doing testing for you as well to make sure you're taking the proper things. Exercise, very important for, moving your hormones and metabolizing, detoxifying. Aim for 30 minutes of aerobic exercise 4 to 5 times a week. Address your stress. Dealing with stress is critical. This is going to take a huge hit on your hormone level if you are not dealing with your stress appropriately. This is going to create a lot of different cascade of hormone irregularities if it's not being addressed. So self-care, taking the time to do the deep breathing, the meditation, the walks, the yoga, all of that, very important. Alternative therapies can be helpful with addressing PMS things, or PMS symptoms, I should say. Things like acupuncture, homeopathy can occasionally be helpful for some. The thing to remember is that women are not defective. We can thrive and be healthy by paying attention to what we're putting into our bodies, by paying attention to our environment. We don't need drugs to survive. We need to just follow the natural laws of biology and clean up what we need to. So I hope this was helpful for you. Some basic tips for addressing PMS. If you feel you're struggling with a women's health issue and you want to try to address this in a functional medicine capacity, give us a call at Nuvie Nutrition, and our number is 248-625-5143, and we hope to hear from you soon. Thank you. Hi there. I'm Brittany Golden. I am a functional medicine nutritionist at Nuvie Nutrition, a Forum Health partner, and I am continuing our videos on Women's Health Month within Forum Health. And so we're focusing a lot on different topics regarding women's health and how to correct them with functional medicine. So today I'm going to be speaking about birth control pills because it's so prevalent. So many women are on the pill, and for a long duration of time, varying reasons why. Most of them not having to do with preventing pregnancy. So that's what we're going to kind of get into here. About 75% of women do suffer from PMS, and that can include a myriad of different symptoms. But basically, it comes down to how the body is metabolizing hormone. What does the gut microbiome look like? What does your stress level look like? What does your environment look like? What does your diet look like? These are the things that are really going to create the cascade of events for hormones to go in an improper direction and cause you symptoms, cause you feeling bad, feeling poorly. So for this, we've got other things too, right? PMS, menopause, perimenopause, estrogen dominance, irregular cycles, heavy bleeding, cramping, mood swings, fertility issues. About 1 in 7 couples are struggling with fertility issues. So if we look at the root of what's going on and why, unfortunately, that's not really addressed in a conventional medicine setting. Birth control pill is often the answer in the conventional medicine world, but there are many side effects. So there are things like stroke, cardiovascular issues like blood clots. If you're on birth control pill, not everyone knows this, if you're on birth control pill for 10 plus years, you have an increased risk of breast cancer. A pretty high risk, actually. There's more prevalence with yeast infections because birth control pill imbalances the microbiome. So it imbalances the gut microbiome, allowing this yeast to overgrow. And so women have a tendency to have issues with vaginal yeast infections. So birth control pills are being used to balance hormones, not really to prevent pregnancy. And yes, it can be used in that capacity as well, but the way to deal with the hormone balance is using birth control pill. But we got to get to the bottom of what's going on. So once you have testing done, with a knowledgeable practitioner, you discover why the imbalances are occurring in the first place. For instance, even with menopause and women who have, hot flashes and things like that, studies show 15 minutes twice a day of meditation and deep breathing significantly cut back on hot flashes. This is known. This is studied. This is, common knowledge for people who want to find it. So that's why we're here to deliver this information, to know that there's more than just the route of drugs to get to the bottom of your hormone issues. If you feel you are struggling with a women's health issue and you do not want to use birth control, or perhaps you're on the pill and you would like to come off of this, there are ways to do that, and we can help you balance your hormones in a functional medicine way, get to the root of what's going on. Contact Nuvie Nutrition today. Our phone number is 248-625-5143. We look forward to hearing from you, and have a wonderful day. Hi there. I'm Brittany Golden. I am a functional medicine nutritionist at Nuvie Nutrition, a Forum Health partner. And I am continuing our video sessions on speaking about women's health, as it is Women's Health Month within Forum Health. And today I'm specifically going to be talking about environmental factors that can affect your hormones. things a lot of people don't think about. So different things we can do to balance these out in a more natural way. So the first topic is going to be, or the first bullet point I should say, that we're going to hit on is sugar. Insulin resistance. So the more sugar you eat, the more insulin resistant we become. This increases our amount of estrogen that's made, and this creates the imbalance of hormones that can happen. And whenever you have, and think too, not just the white refined sugar like you're eating candy and stuff like that. We're talking breads, pastas, baked goods, bagels, things like that. Oats even, although it's healthy and it does have some fiber, if you are only eating just that and spiking that blood sugar high and you're insulin resistant already, depending on the amount that you're eating, the time that you're eating it, it can break down to sugar very quickly. So when you have this breakdown to glucose that's very fast because of the type of food that you're eating, that creates a lot of weight that can be around that midsection. This makes more aromatase enzyme, which makes more estrogen in the body. So it just keeps popping that level up, and that causes this cascade of issues of symptoms with people. So having like the hormonal acne on the chin, the mood swings, the PMS, irregular cycles, infertility, PCOS, endometriosis, lots of different things that I see with my own clientele. And by addressing the lifestyle and a lot of these environmental factors, it can have a huge impact. Number 2 is alcohol. Depletes vitamin B. So this is huge. Your B vitamins are very important, so depleting those is not a good thing. Alcohol impacts your risk of breast cancer. So even one drink a day actually is linked to an increased risk of breast cancer. That's pretty significant. So that's one thing that I have my clients all watching very closely. Alcohol results in higher levels of free estrogen in the body. So this, of course, is going to, again, if you think about that estrogen level rising and rising, that's what causes a lot of those imbalances and symptoms for people. Alcohol affects sleep. Okay, so if you're not sleeping properly, sleep is where a lot of hormone balance and insulin regulation happen. If that's not happening while you're sleeping, we have problems. Alcohol is a liver toxin. At the end of the day, it's a toxin. It impedes your body's ability to metabolize estrogen. So really, really significant stuff here. The other category that I'm going to get into, and this is near and dear to my heart, is endocrine disrupting products. So this is really my wheelhouse. I'm all about having my clients learn how to detoxify their home. So the first and foremost thing is getting rid of your plastic bottles and your plastic Tupperware containers. Storing your food in that plastic and drinking water out of that plastic, it leaches and then you're ingesting. And BPA, bisphenol A, is a endocrine disruptor, so it can imbalance your hormones in and of itself. Phthalates. Phthalates are in food packaging, they're in cosmetics, they're in children's toys, and they're in fragrances. So in your perfumes, in your candles, and your deodorants, anytime that you're looking at an ingredient list on a product that you're about to put on your skin or into the air, and you see the word fragrance, there are over 6,000 chemicals that word can encompass. So it's very important for people to eliminate products that have that word because so many things can hide within it. Parabens are another one. They mimic estrogen in the body and they are linked to an increased risk of breast cancer. Parabens are in lotions and cosmetics and things like that as well. So be really careful with your products. The other thing to consider with environmental factors is exercise. We need to be balancing our blood sugar with exercise and metabolizing our estrogen as well. Sweating is also a fantastic detox, so it's another way to get toxins and excess hormone out of our body. The last thing would be stress. Self-care, so important. Your yoga, your meditation, your deep breathing, decompression. So, if you feel you're struggling with a women's health issue, a hormone imbalance, and want to get to the root of the problem in a functional medicine capacity, please give us a call, 248-625-5143. We look forward to hearing from you. Thank you so much. Hi there, I'm Brittany Golden. I'm a functional medicine nutritionist at Nuvi Nutrition, a Forum Health partner, and I am continuing our videos speaking about Women's Health Month. Forum Health is hosting Women's Health Month within the month of October, and we're speaking about various topics regarding hormone imbalance and issues regarding women's health, and how to kind of get to the root of those with a functional medicine approach. So today's topic is the benefits of a functional medicine approach. So when it comes to hormone balance, conventional medicine has little to offer, unfortunately. It usually comes down to two things: either birth control pills or hormone replacement therapy. Both of those come with a risk, a big risk, higher risk of breast cancer, blood clots, stroke, estrogen dominance, etc. So most people don't want to go that route, but they oftentimes don't know that there's another option. That's where functional medicine comes in. So functional medicine is a different approach. This is where we work to kind of define the imbalance, get to the root of why is the problem going on in the first place. Sometimes this means deeper testing, but more often than not, it's addressing the lifestyle of the individual as the cause of the imbalance. The majority of my clientele are women, I would say, and about 75% of them have a hormone imbalance of some kind. Irregular cycles, heavy bleeding, endometriosis, PCOS, hot flashes, etc. The list goes on. Most of these have come on by poor diet, chronic stress, lack of sleep, environmental factors like poor choices in cleaning products, beauty products, fragrances, etc. So instead of covering up the symptoms with a pill that puts you at risk for cardiovascular issues and cancer, functional medicine approach teaches you how to change your lifestyle, helps you to get to the bottom of why the imbalance is happening in the first place. Now, like I said, sometimes this comes with looking into further testing, like a Dutch test, or looking at the gut microbiome to see if that's the reason that there's an issue. But finding the root of what's going on can be so beneficial, and avoiding the risks that come along with those drugs. So we can do this in a drug-free way, and addressing lifestyle is usually the way to go. So if you feel that you have a women's health issue or hormone imbalance and would like to get to the root of it in a functional medicine approach, we would love to help you. Please give us a call, 248-625-5143. Thanks so much. Have a great day. Hi there, I'm Brittany Golden. I'm a functional medicine nutritionist with Nuvi Nutrition, a Forum Health partner. And we're continuing our discussion with women's health being the topic of the month for October within Forum Health. And today's topic is going to be talking about women's health supplements. So this topic is a little tricky because it depends on the age of the individual of what I would recommend for somebody specifically regarding supplements. So first and foremost, we always make sure we say you should be working with a knowledgeable practitioner when it comes to supplementation, especially when it comes to balancing your hormones. There are many things that can be helpful, but you have to be kind of monitored as you're taking some of those things to make sure we're on the right track. What works for one doesn't all the time work for the other. So that's the other thing, is sometimes having somebody have eyes on what you're doing can be very helpful for navigating what's going on with you and your progress and your symptoms. So first and foremost, I always recommend, no matter what the age is, a multivitamin to make sure that you're getting the proper phytonutrients. A probiotic so that you are getting some beneficial flora going through the gut at all times. Vitamin D, especially like for someone like myself, we live in the mitten, so we are not getting very much sunlight for a large portion of the year. Vitamin D is really responsible for hormone balance, among a lot of other things as well, but that's the one thing that comes to mind when we're speaking about women's health. A fish oil, so really good quality omega-3 fish oil is very important. And a gut healer a couple of times a year that includes L-glutamine, because gut health can have a huge impact on your hormone levels. So other supplements that I would recommend for varying issues, you wouldn't take all of these that I'm listing, but for one, I think of evening primrose oil. This is effective at reducing PMS symptoms, things like cramping, bloating, water retention, breast tenderness, things like that. I use chasteberry or vitex, both words are interchangeable there. They can help balance your hormones released by the pituitary gland, and they can kind of control your overall hormone function, but I specifically use this for mood, cramps, irregular cycles, and heavy periods. Indole 3-carbinol is another one that I use, or Met I3C is another thing that it's called. This promotes healthy estrogen metabolism in the body. It's basically like taking a pill that's got a high dose of broccoli and cruciferous vegetables powdered, because cruciferous vegetables are fantastic at metabolizing estrogen. Black cohosh is another thing that I use, and this is for hot flash relief, so this would be used for my menopausal women. Irritability, it can support relaxation as well. Also for my menopausal women or perimenopausal, I would be recommending bone support, so something along the lines of a combination like vitamin D, magnesium, and calcium with a hydroxyapatite component to it that can help solidify bone and help to rebuild bone structure, remineralize, I should say. So those are the ones that come to mind. And if you feel like you would like to have someone take a look at what you're doing with your supplements, have a knowledgeable set of eyes to give you some guidance on some supplement protocols, we'd love to help. Our phone number is 248-625-5143. Thank you so much. Have a great day.